About 4 billion years ago, these tiny living things called bacteria dominated the planet and its oceans. These bacteria are in fact so small that they can only be seen using a microscope. But even though you may not see them, bacteria live all around us and can be found virtually everywhere. From the bathroom sink, to your kitchen table, even within our bodies and on our skin. But before you get all freaked out, it's important to note that not all bacteria is actually bad for us. In fact, much of the bacteria we associate with is actually healthy for us, like the bacteria we have in our mouths, our gut, or bacteria from foods like yogurt and cheese, which are important for digestion. Whereas harmful bacteria can cause you to get sick, causing throat infections, ear infections, and many more. So how is it we fight off these harmful bacteria in order to treat these kinds of sicknesses? The answer is antibiotics. Antibiotics are medications that fight the bad bacteria and help you feel better. In fact, the word antibiotic literally means against life. Antibiotics are prescribed by a doctor and have been very effective in treating bacterial-caused illnesses for many years. At some point in your life, you too have probably been given antibiotics by your doctor. And even though you may not always want to take them, it is important to always follow the advice and medical direction your doctor gives you. Some infections can cause serious consequences if left untreated and need the antibiotic superpowers to fight them. However, more and more antibiotics are no longer working. Have these antibiotics lost their superpowers of destroying bacteria? What is actually happening is that bacteria are becoming resistant to some antibiotics, meaning they are no longer being killed off by these medications. Bacteria, just like all living things, can randomly mutate or change slightly. These changes may be bad for the bacteria, good for the bacteria, or make no difference. Some bacteria may randomly mutate so that the superpowers of the antibiotic no longer work on it. These bacteria do not get destroyed by the antibiotic, and so they are able to survive. These evil bacteria increase in numbers and pass on their genes to other bacteria, creating an entire army of evil bacteria. But how exactly are these evil bacteria resistant to antibiotics? How is it that they fight off these medications? Many antibiotics work by attacking the cell wall of a bacteria. Think of the bacteria like a villain wearing armor. Antibiotics will work to break down that armor, and without this armor, the bacteria have less chance of surviving in the human body. So one way bacteria can become resistant to antibiotics is making changes to their cell wall. So they have stronger armor that the antibiotics aren't able to attack through. Another way they do so is by attacking the antibiotic from the inside using enzymes. You can think of enzymes as a tank of piranhas in the bacterial's evil lair. As the antibiotic enters the lair, they are thrown into the tank and devoured by piranhas so they can no longer function. Lastly, the bacteria may have an efflux pump that pumps antibiotics out of the cell. You can think of this like a warp pipe that Mario goes through in Super Mario. When the antibiotic gets into the cell, it is immediately pumped out by one of these pipes, and so it can no longer attack the bacteria. The growth and spread of these evil bacteria is a serious problem. Scientists are working to increase education about this problem, improve public health, develop new antibiotics, and see if there are any other treatments for certain infections. To learn more about how antibiotics work, check out the links in the description below. If you like this video, please leave a like and subscribe to the Demystifying Medicine YouTube channel. Thanks for watching!